Hello, everyone. Welcome to Brainwaves. Since its very beginning in the mid-1990s, IMRO has funded programs to strengthen the brain health of young people at risk for serious mental illness. Over the last couple of years, I've been really pleased to notice a growing interest in this, growing public interest in this area of research and treatment. And to further this growing movement, IMRO has launched its Research for Young Minds fundraising campaign. And the beneficiaries of this campaign will be Psychosis Prevention Research and Treatment Centers, most notably CAPPS, the Center for the Assessment and Prevention of Prodromal States at UCLA. CAPPS is a cornerstone in a nationwide network of centers of its type. They're providing innovative treatment services to young people at risk. And here to tell us about the helpful approaches for treatment and research that CAPPS is doing is the director of the center, Dr. Carrie Bearden. Carrie, thanks for returning to Brainwaves.
Oh, it's my pleasure, Brandon. Thanks so much for having me back. And I'm absolutely delighted that this is going to be a focus for IMRO in terms of a fundraising campaign.
Well, you're very welcome. Yeah, it's a very worthy program, and let's hear more about it. I mentioned that youth mental health is becoming a hot topic, and so what role has CAPS played as one of the first centers of its type and as a part of a nationwide network of centers in this growing movement?
Yeah, so I think there is really growing awareness that earlier intervention can really make a substantial difference in outcome for young people with a variety of mental health issues. And particularly for psychosis, there is really now, I think, very consistent evidence that earlier intervention, the earlier one gets in there and intervenes, the better the treatment outcome, both in terms of symptomatic remission as well as long-term functioning. And so, at CAPPS here at UCLA, our Center for Assessment and Prevention of Prodromal States, I'm really proud that we've played an important role in really increasing awareness out in the community about what are those early warning signs, what do you look for? And so, we give talks to school counselors out in the community, to community mental health centers to really let people know what to look for and that that appropriate treatments are available.
Awesome. That's fantastic. And what innovative therapeutic approaches does CAPS offer to its young clients who are at risk?
Well, so our approach is really individualized. We approach each person who comes to us really based on their current symptoms and current needs. And the other part of our approach that I think is really unique and special is that we really take the entire family system into account. And there's a lot of evidence now that that's actually really important in improving treatment outcomes. And, we found that working with the family is really much more effective than just treating somebody as their own little island. And, from that standpoint, we found that family-focused therapy, which was actually developed by my colleague at UCLA, David Mikulowicz, for treatment of bipolar disorder, we've modified it for treatment of early psychosis and prodromal symptoms of psychosis and found that that's in fact really effective in improving symptoms, reducing symptoms, as well as improving functional outcome. So I think that's really exciting. And then the other novel treatment that we're starting, which I'm really excited about, is a cognitive training that's neuroplasticity-based cognitive training, and we're doing this in collaboration with colleagues at UC San Francisco, and really focusing on the idea that early perceptual processes are likely impaired in people with early psychosis, and that we can improve, if we train on those early perceptual and attentional processes, it can really improve higher up, higher order cognition as well.
Okay, yeah. I used a program like that back in the 90s, as I've talked about on Brainwaves before, and it helped me.
Yeah.
So I can vouch for the effectiveness of that. What feedback have you received from clients and families who have participated in CAPPS that the treatments that you offer have been worthwhile?
Well, so, the positive feedback that we receive from our clients and their families is really, I think the most inspirational thing about doing this kind of work. And, adolescents, so mostly we see youth, adolescents between the ages of, and young adults, 12 to 25. So this is a really dynamic period where there's so much going on. And, it's really rewarding to see that the majority of our clients do, in fact, get better. And so we receive a lot of very positive feedback from families and a lot of gratitude, really, that they've been able to find a program that actually understands what's going on with them and that really, can help them channel into the most appropriate intervention.
That's great. And then, so what new developments and discoveries in research has CAPPS and the Naples Consortium, of which it's a part, discovered in the last couple of years or so to improve early detection and early treatment for psychosis?
Yeah, so let me just summarize a couple of our recent findings that I think are really exciting. So from our Naples Consortium, we have been looking at particularly at brain biomarkers that we think may be predictive of the development of overt psychosis, the development of full-blown symptoms. And so one of the things that we found is that there's in fact a process of this accelerated rate of gray matter loss. So that's the gray matter is really the tissue we think of as brain cells. So there's an accelerated loss of gray matter, particularly in the frontal cortex of the brain, in people that go on to develop a full-blown psychotic disorder. And so this really suggests, at this point, we don't have a particular treatment for this, but really being able to pinpoint something that's changing and that we might be able to target and actually, use as a potential biomarker for intervention is exciting. And the other interesting thing about that is that gray matter loss was actually correlated with another novel imaging measure that we have of neuroinflammation. And so we think that there may be something about inflammation that's relevant to these changes that occur. And we don't know whether it's causal, but we think it might be. And so that's something that we're going to be investigating further in the next phase of the study. And then the second finding that I also think is really important from a clinical standpoint is we've been looking at individual risk prediction. So, a lot of times our work is really based on group averages. And so what this is doing is really trying to take that to the next level and really being able to tell for an individual person, what is your chance of developing psychosis over the next 2 years? And it turns out that really based on a couple of specific symptoms, which are unusual thought content and suspiciousness, so more severe levels of those two particular symptoms really carried a lot of weight in our predictive algorithm, as well as a couple of cognitive measures. And so, what I think is really helpful and important about this is that we may be able to take these readily into primary care clinics, perhaps. And so that's really the next level of where I hope we're taking this work.
I hope to see it go there. The more widespread that early screening for psychosis and other serious mental illness symptoms can be conducted, the more young people can be helped at an early stage and
Right.
go on to reach the potential that they deserve. And so on that note, do you have any words of inspiration or encouragement that you can offer to young clients and their families, young people who might be at risk for psychosis, to help them better prepare for pursuing the bright future that they deserve?
Yeah, so I think there is a lot of cause for optimism. Even though we are typically seeing people that are in distress when they first come in, there's a lot going on. There's a lot of stress and a lot of, it's a really hard process to understand. And a lot of times the families are really struggling to understand what's going on, but really getting into treatment. And a lot of times it's not necessarily medication, but psychosocial treatments that really improve family communication, reduce stress, improve coping skills. Those treatments all are really effective. And those are things that we can do right now. And so I think it's important to know that for people experiencing prodromal symptoms of psychosis, the majority don't develop a full-blown psychotic disorder. And even for those who do, there are treatments that are really effective and helpful in, not only improving symptoms, but also improving role functioning, so functioning in the community and social functioning. And those are the things that I think that we are really trying to target now, because we really do see some benefit of these psychosocial interventions.
That's great. That's great. Well, thank you, Carrie, for all these explanations. They are very encouraging. And so if people have any questions for you on the Brainwaves page after I publish this recording, are you ready to answer some questions?
I would be delighted to answer questions. Please send questions my way, and I'll be happy to do my best to address any questions that come up.
Thank you, Carrie.
Thanks, Brandon.